Good afternoon. I appreciate anybody tuning in and listening to me. My name is Mike Power. I am a Medicare, or as we are known, a SHIP counselor, S-H-I-P. SHIP is an acronym for a program of mostly volunteer counselors that are called State Health Insurance Assistance Program counselors. We're trained by the Department of Human Services Division of Aging to assist people in navigating questions and concerns they may have regarding Medicare. Medicare is a very important subject for most people as they age. Most people relate to Medicare as, I'm turning 65 because that's the normal time that most people enroll. In addition, there are a group of people who are receiving Social Security disability benefits who are also eligible for Medicare after 24 months of receiving SSD benefits. This all comes about, in some cases, automatically. If you are 65 and receiving Social Security retirement benefits or still continuing SSD benefits, you will be automatically enrolled in Medicare. And what happens, usually 3 months prior to your 65th birthday, you will get a package of information from the Social Security Administration, and in it will be your Medicare card. For people who are still working at 65, and that invariably are a lot of the people I speak with in my counseling, people who are still at 65 working, who are concerned about whether, in fact, they should take Medicare based on recommendations they've heard from family, friends, and other people. The answer I give to most people is it depends. It depends upon if you have an employer-based coverage that you like, number one, and number two, if there are more than 20 people enrolled in that coverage. If you like the coverage and you have more than 20 people, then you really don't have to take Medicare at 65. It's an option, and that includes even taking something called Medicare A. The reason I say it's an option is because Medicare Part B comes with a monthly premium. And most people, if they find that they have duplicate coverage for their employer plan, they may want to omit or even avoid that premium by not taking Medicare B. What I'm going to do now is I'm going to go into a little bit more specifics as to the parts of Medicare. Medicare, or traditional Medicare as we call it, is Part A, which covers inpatient events or hospitalization. Or after you've been hospitalized, let's say you're discharged to a step-down facility, such as a skilled nursing facility, in order to help you recover from your hospitalization. Or you might have to go to a subacute rehab facility. Part A also covers hospice care, which a lot of people don't know, and frankly, God willing, they don't have to encounter until when they're at the end of their life. That's Part A. We call that inpatient care. Part B gets a little hairy, and I say that only because it's a broad base of coverage. Part B covers mostly what's called medical provider, but it also covers a whole lot of other things, including outpatient visits, trips to the emergency room via an ambulance if it's an emergency, direct care in the hospital by a doctor, a provider. Durable medical equipment. Sometimes you may be discharged from a hospital and it's part of your discharge plan is you need equipment, maybe a bed, maybe some other stuff. So Part B covers a whole wide breadth of areas pertaining. So Medicare A, generally, if you have worked for a minimum of 10 years or 40 quarters and contribute to FICA for 40 quarters, you don't have to worry about a premium because generally under the law, you get Medicare Part A for nothing. That's a good thing because if you had to pay for Medicare A, the monthly premium is rather high. It's over $450 a month. And I do recommend, if you can, make sure that you have contributed to FICA. Part B, because of the breadth of what it covers, basically has to charge a monthly premium, whether you've contributed to FICA or not. And that contribution for 2023 is $164.90. Now, let's go back to where I said, if you're taking currently Social Security and you're turning 65 and you want to enroll in both Parts A and B, all you have to do is wait. The card will come to you generally 3 months prior to your 65th birthday. And that means all you have to do is open the envelope, punch out the card. I recommend everybody go get it laminated because it's thick paper, and as we all know, paper sometimes wears out. So go get it laminated if you're going to keep it. If, on the other hand, you have coverage, alternate coverage, either through your employer or in some cases through a partner or a spouse, and that also includes the equivalent of medical care, you may not want to take Medicare Part B. You may want to just take the Part A and avoid the B until you no longer have the medical care from your partner. You can do that. What you do when you get the card, if you want to, it explains to you to sign the card, send it back, and send it back to Social Security, and they'll make note of the fact that all you want to sign up for is Part A. You will then get a card, a Medicare card that says effective date, your 65th birthday of when you sign up with Part A. Now, as a fact, generally when we sign up for insurance, it starts the first day of the month. In other words, if you turn 65 this month, you would expect to receive your Medicare card, and it would have on it an effective date of 7/1/2023. So it's pretty easy to understand. The last part of Medicare that everybody has to have, because the law was added to in 2006, is prescription drug coverage, or what we call Part D coverage. Part D coverage specifically covers medications that we administer to ourselves. That includes salves, creams, pills, ointments, and in some cases, injections. Injections such as insulin or other types of medications that you might need. In other words, anything we administer to ourselves that we ordinarily would obtain the medication at a pharmacy or through a pharmacy vendor, that's considered Part D. Now, there is another category, another section of Medicare. It's called Part C. Part C is really, in fact, a form of comprehensive coverage, incorporating both Parts A, B, and prescription drug coverage into one unified coverage. These are offered by private insurance companies. And if you're interested in a private consolidated plan, you can always go talk to an insurance salesman. Or if you want more information, you can always come and talk to one of our SHIP counselors in the county. Right now, there are about a dozen of us. We're almost all volunteers. There are SHIP counselors who are affiliated with different not-for-profits. So if you go to that particular not-for-profit, you might be able to find or ask to speak with a trained Medicare counselor or SHIP counselor. That said, there are also programs that you might be available to, or anybody you know might be available to offset the cost of things. Medicare B comes with a monthly premium. Prescription drug coverage comes with a monthly premium, and then, of course, a copay. Part D also comes with something called a deductible, an annual deductible, which unfortunately for the last, I don't know how many years, keeps going up. Right now, this year, it's $505. One thing I failed to mention, I might as well go back and mention, is that Part B also has an annual deductible, and that right now is $226 for 2023. Part A, if you go into the hospital, you're admitted. Let's just say hypothetically, you go to the emergency room, doctors examine you and say, nope, you need to be admitted, we're going to treat you. That means then you're moving from an an outpatient setting, which is Part B billable, to an inpatient setting, which is now Part A, because you're now inpatient. There is, in fact, a deductible payable to the hospital. It's called the Part A coinsurance. That's $1,600. That means every time you go into the hospital and you're admitted, up to 60 days, you may have to pay that amount of money. There are ways to offset this. If you're lower income and you need assistance, my encouragement to anybody listening to this is seek out a SHIP counselor. Seek out one of us. We can assist you in navigating whether you're eligible for the assistance, what level of assistance you might be eligible for, and assist you even with going forward and filing the necessary applications. That is a wrap for me. I have covered generally, what Medicare and SHIP is. If you want to see a SHIP counselor, there are two ways to access this. One is to contact the main SHIP coordinator's office, which is located in Family and Children's Services, Monmouth County. That number is 732-222-9111, which is the main number, and just ask to speak with the coordinator of the SHIP program. and you'll be connected. The other way is to contact the Office of Aging, Disability, and Veteran Services, which is located in Freehold at 732-431-7450. As a matter of fact, actually, that is my assignment. That is the office in which I counsel from, and I'm available generally 2 days a week. Thank you very much for listening to me. It's been a pleasure. God bless you all.